going to give a quick overview of how Haywood Regional Medical Center has partnered with one of the wound care experts, which is Healogics, and they have about 800 wound care centers across the United States. So what that means for Haywood is that we get to use all of that expertise and bring it into our community. So clinical practice guidelines, well-researched different healing modalities that will be available right here. So with that said, I'll have to go a little quick because I know Rod likes to talk. Why would we expand wound care services at Haywood? Well, one of the reasons is obviously we're all aging, but we're living longer. So that means people are living longer with chronic disease. And our higher rates of diabetes, I think I read something yesterday that it's about from like 2008 to 2050, but we're going to see about 165% increase in people with diabetes. So that's a big number. Like I said again, chronic disease and obesity, and what that equals is the higher rates of chronic wounds. And about 30% of people living with chronic wounds will undergo some type of amputation. And I can tell you from all of my years in the operating room, about 12 years in the operating room, that if I had known that some of these services were available and we could tell our communities and people about that before they ended up in the operating room with an amputation, we'd be a lot better off. So those 30% of amputations, about 50% of those people that have an amputation will die within 5 years. So that's a reason to bring that to our community. Hospitals are challenged by treating wounds. So when we don't treat wounds and we don't use the best modalities available, patients end up staying in the hospital longer. And by having an outpatient wound care center, like we're going to bring and we have here at Haywood, we can be able to treat those people and make their length of stay in the hospital a lot shorter. So we're excited about that. So what is specialized wound care? Well, what we do is all evidence-based. And we have done a really good job in the past at Haywood in treating wounds, but now we have the evidence and research and clinical practice guidelines to lead us in our practice. Our staff is trained in Jacksonville. They go through a 5-day training session with Healogics, as well as our providers. And that's really an intense learning opportunity for them to be able to bring those different healing modalities back to Haywood. So on the right there, you'll see the different types of wounds that we treat. So no longer is it just bed sores and some small surgical wounds, but we're really looking into the future and be able to deal with people who have undergone radiotherapy for cancers, and now have radionecrosis. So we're looking forward to treating all different types of wounds at the Wound Care Center. Our center is provider-driven. Like I said, we have a medical director. Actually, some of you might know him. Dr. Joseph Miller is coming on board with us, and he has just completed his training in Jacksonville and is really excited to get this program up and running. So when a patient comes to see us in the Wound Care Center, they meet with a case manager as well as our provider, and we come up with a complete plan of care. And that plan of care includes basically why the patient's not healing. We're not just looking at what the wound is and what kind of dressings we can put on it, but why isn't that wound healing? So chronic wounds, we know, if that wound hasn't healed within 1 to 3 months, we need to look at other reasons as to why that your wound isn't healing. Our center offers advanced treatments. So one of the things is we're using is being able to debride out necrotic tissue or tissue around the wound that really makes it difficult for a wound to heal. Negative pressure wound therapy, which is basically using a vacuum on top of the skin with a sealant dressing that just helps with skin and cell proliferation. We also use multi-layer compression therapy, topical skin substitutes, different growth factors. So we're just looking forward to being able to provide these services. In coming in the second quarter of 2017, there is a building behind the hospital. It's the home health building, and it's being renovated to be the wound care center. And in that wound care center, we're going to have 2 hyperbaric chambers. And to bring that close to home, to be able to provide that service close to home is really a nice benefit. And we really appreciate, Haywood putting time and investment into this opportunity. So really what hyperbaric therapy is, it's been used for over 40 years in wound healing. But what it does is it basically super oxygenates the skin and tissues to help heal wounds. And so reduces swelling, helps with infection, those types of things. And why is hyperbaric therapy so important? It's important because if you think about someone who goes in for an amputation like we talked about before, that is of over $100,000 for that one amputation procedure, hospital stay, and things like that. For a patient to go under 5 90-minute chamber sessions to heal a wound, it's about $25,000. So up front, there's some cost, but again, if we can spend $25,000 and reduce the risk of amputation, things like that, compared to $100,000 and extend a hospital stay, we're doing pretty well. So we're excited to bring that service. So some of the benefits to our community, again, is the biggest one on this is really limb salvage to me. I think, we just had a patient this week, and we're hoping to use him as somewhat of a spokesperson. He went to see his physician, and the physician said that toe needs to be amputated. And he said there has to be something else out there. And so he came to see us. And yesterday he left the wound care center with his toe, and he's healed. So that's what we're trying to do here. We really want to make sure, not that his physician was wrong, but now this is really a specialty area, and for a physician to say, hey, I know where I can send you, I know where you can get the best care, and then us returning the favor and telling them to return back to their primary care physician, of course. So we're improving quality of life. We were just talking about it this morning, what a beautiful place this is to live. And to maintain and not have an amputation and things like that is important. So we want to help patients understand their condition so they don't come back. So part of my role in the community is to come out and talk with all of you folks, as well as skilled nursing facilities, home health, to know that that we're here to serve you and to make sure that patients don't have to live with these chronic wounds. And of course, preventing the reoccurrence. So who will benefit? One of the things I want to highlight on this slide is, and it hadn't been done before at Haywood, is a self-referral. So you don't have to go see your primary care doctor first if you have that wound that's not healing. You can call us and we'll get you set up. And then if you wish, we'll send you progress notes back to your primary care physician so they know what we're doing to help heal you. Well, we want to make sure that we can, and it's not just about wound care and applying the dressing, like I said. It is more about using advanced technologies and research to be able to heal those wounds. So a lot of the wet to dry dressings that I know we're all used to, doctors are used to, knowing that we have this available now is a great benefit to our community. So I just want to thank you for all your time, and you can find us on myhaywood.com wound care. We're available there, and I have my card out on the table, but please look us up and tell your families and friends that we're here and that we are expanding our services. Thank you so much.